Good afternoon, everybody, and welcome back to day 2 of this online symposium, recognizing, respecting, reimagining 50 years of learning from carers and shaping what comes next. The theme of the whole day today is focusing on current realities, emerging challenges, evidence-informed approaches and opportunities to improve support for carers across systems and diverse communities. Before we get started, I would like to open the session by acknowledging traditional custodians of the land that I'm joining from today. For me, that is the lands of the Gorgo people. And I extend my respect to elders past and present from this land, as well from all the traditional lands represented by our attendees today. Please feel free to add the lands that you're joining from in the chat. My name is Lukas Hofstätter. I'm the Manager of Research and Development at Carers New South Wales, and I'm very pleased to welcome you this afternoon. This event has been developed in collaboration with our guest speakers and contributors, and it is wonderful to see so many of you joining us today. Please note that today's session will be recorded and shared for on-demand viewing. We ask everyone who is not part of the panel, please mute your microphone and turn off your cameras, so we can focus on the presentations and the panel discussion. We recognize that we have many carers and others with lived experience joining us today. If you hear something that causes you distress and you need to talk to someone, we have a dedicated wellbeing officer available online who you are welcome to contact. Further information about how to do so will be posted in the chat right now. This event brings together participants from diverse backgrounds and areas of expertise. Our aim is to create a positive learning environment for all participants that is based on kindness and respect, where all perspectives are valued. You're welcome to add questions and comments in the chat throughout the session, and we will use the Q&A function as well. For some of you, this may be your first introduction to the Care Knowledge Exchange, or CKE. The CKE is a research translation project led by Carers New South Wales and funded by the New South Wales Department of Communities and Justice. This year marks the 5th time we hold such an online symposium or research incubator and the 50th anniversary of Carers New South Wales. Over the past 5 decades, carers' voices and lived experiences have helped shape important conversations across research, policy and practice. This event provides an opportunity to reflect on that progress while also looking ahead to what still needs to change to improve outcomes for carers and the people they support. Earlier today, we explored policy and practice innovations across a range of sectors and discussed what is currently working well for carers, what is changing across systems, and where further improvements are still needed. This afternoon, we will continue those conversations through 2 panel discussions. The first one, which is starting right now, has the theme of supporting carers who are living with a disability themselves. And the second one, shortly after that, will focus on supporting CALD and refugee carers. We will begin the panel supporting carers living with disability, which will explore the intersection between caring and living with a disability. The discussion will consider how this intersection shapes carers' experiences, the current state of knowledge and evidence in the space, and what changes are needed to better recognize and support carers in that intersection. And I'm very, very happy to introduce our panelists. First off, Josephine Wyborn. Josephine is a researcher with experience in brain injury rehabilitation, cognitive disability, mental health, and health services research. Since 2015, she has worked across organizations, including New South Wales Health, the University of Wollongong, and the Agency for Clinical Innovation. She's particularly passionate about improving equity within the Australian healthcare system for people with intellectual disability. Welcome, Josephine.
Thank you, Luke.
Second presenter, I'm very, very happy to welcome Aspen Luke. Aspen is a lived experience speaker and writer with a passion for disability, young carer, and LGBTQIA+ advocacy. and activism. He worked with Carers New South Wales on the Young Carers Advisory Group in 2023 and 2024 and completed training to be a care representative in 2023. He has also been an advisory team member with 2010 and the Sydney Local Health District. He uses his lived experience of disability and care work to spread awareness about carers living with a disability. A really, really warm welcome to you, Aspen.
Thank you, Lucas.
Today. And our third presenter will be Kelli-Ann Sives. Kelli is a senior leader with over 25 years experience across the community sector with a strong focus on strategic leadership, policy and program development. As acting manager, policy and development and inclusion lead at Carers New South Wales, she leads initiatives that influence policy, strengthen partnerships and improve outcomes for carers and their employers, underpinned by a strong commitment to equity, social justice and human rights. Welcome, Kelli.
Thank you, Lucas.
Thank you all three, and we will begin by hearing from Josephine. I will now hand over to you, and you will talk us through the evidence base available around supporting carers living with a disability. Over to you, Josephine.
Thank you so much, Lucas. Just give me a moment while I share my screen with everyone. Okay, so hi everyone. Lucas already did a great introduction. It's Josephine Wyborn, Research Officer at the Centre for Disability Studies. I'm also a PhD candidate with the University of Sydney. So today I'm going to talk about caring while living with a disability, but mostly just from a lens of my own field. So some reflections from intellectual disability and health research. So I would like to begin by acknowledging the traditional custodians of the land that I'm speaking from today, the Dharawal people. I pay my respects to the elders past and present, and I also extend that respect to the Aboriginal and Torres Strait Islander people joining us today. So today I'm going to talk a little bit about the topic from my own lens as a researcher in intellectual disability, as well as someone with lived experience of caring for my sister who had cerebral palsy, as well as my mother who has bipolar disorder. So my research focuses on health systems, healthcare quality for adults with intellectual disability, but it also really heavily focuses on the involvement of carers and support people. So a lot of my work has involved listening to people with disability, families, carers, and health professionals describe their challenges navigating really difficult systems. So I'm by no means an expert on carers living with a disability, but I've really seen this issue emerge a lot across my research and my lived experience as well. So I wouldn't be a researcher if I didn't start off with a few statistics. So 61% of people with an intellectual disability rely on informal support only to access healthcare. Nearly half of primary carers in Australia also live with a disability themselves. 1% of Australian parents are estimated to have an intellectual disability. Yet we rarely talk about how some people with an intellectual disability could also be carers, parents, or support people. So one thing that's really stood out to me, both through research and lived experience, is how often caring and disability can overlap. Yet our systems don't always recognise this complexity very well. So in research, carers are often talked about as though they're completely separate from the disability. But many carers are also managing their own disability, like chronic illness or mental health challenges or neurodivergence, for example. I think this is because systems are often designed very different categories. So there's either the carer, the patient, or the person with the disability, and people's who their lives sit across multiple roles can sometimes be a little bit invisible to the system. So what I've noticed is that these overlapping experiences can create a lot of pressure, particularly when systems are already fragmented and really difficult to access and navigate to start with. So I think these issues become the most visible in day-to-day realities of navigating systems, so disability systems or health systems. So from what I've seen through research and lived experience, carers with a disability are often managing multiple layers of responsibility at once. That can include coordinating healthcare, managing appointments, navigating disability supports, advocating within systems, and supporting family members, all while trying to manage their own health and support needs. So I think this ultimately can create significant emotional, physical, and financial pressure over time, sometimes leading to burnout and exhaustion. So I can see in my own field that there is really very little attention that's been given to carers who are living with a disability themselves. There's still very limited research exploring their experiences, their needs, and the unique pressures that they would face, they might face navigating their caring role. From a systems perspective, I think there's some really important questions that we still fully don't understand and that we need to ask. So, how disability impacts caring roles, what barriers carers with a disability face when they're accessing support, how health, disability, and care systems can better respond to them and their needs. I believe there's some relatively practical things that systems could start doing better for this population. So firstly, just recognizing carers with a disability more explicitly within policy, research, and service design. Secondly, making supports more coordinated and accessible, because many carers are navigating multiple complex systems at once for themselves and the person they're supporting. This can be really confusing and overwhelming. I also think we need to move away from the assumption that carers will simply continue filling gaps and that they have an endless capacity. And importantly, lived experience needs to be genuinely included in designing supports and services moving forward. So I think one of the biggest reflections I have from both research and my lived experience is that carers with a disability are often expected to continue supporting others within systems that are not always designed to support them in return. Across healthcare, disability, and carer systems, there can still be assumptions about what carers are able to take on without enough recognition of their own support needs, their health literacy, accessibility requirements, or just their overall well-being. Ultimately, I really hope conversations like this help move us towards more inclusive and responsive systems that better recognise support carers that have a disability themselves. So that's the end of my presentation. Thank you so much, everyone, for listening to that. I'll pass it back over to you, Lukas.
Thank you so much, Josephine, for this great start to set out what the problem is. And I would just hand it over directly to Aspen, who will talk about his experience. Thank you, Aspen.
Sorry. Hi, my name is Aspen, and I'm a lived experience speaker and care representative with a passion for disability and young care advocacy. For anyone who may need a visual description of myself, I'm a white masculine presenting person with red hair, and I'm wearing a black shirt. Today, I'll be sharing with you my story about being a young carer with a disability. I will also talk about the challenges that carers with a disability face and how to support these people in both personal and professional environments. Before I begin, I would like to provide a content warning for child loss. In 2011, my mother unexpectedly lost her baby during labor. This traumatic experience understandably triggered significant mental health challenges for her. I was 5 when my brother died, and it was incredibly difficult to lose a sibling at such a young age. The grief was overwhelming for all of us. I saw and understood the pain my mother was going through. I witnessed her become a different person, and I knew she needed help to get through this tragic loss. As a highly empathetic 5-year-old, I wanted to help her in any way I could. It started with small tasks to make my mum feel better, and over time morphed into what would be a full caring role for her mental health and chronic health conditions. This looked like helping with medications, cooking, cleaning, attending appointments, and assisting with self-care. I was a carer for my mother for the next 13 years. The content warning has now ended. In 2013, my sibling was born. To our surprise, they were born with a lot of health issues, which was later identified as a chromosomal duplication called 22q13.32 duplication and autism spectrum disorder level 2. The beginning of CJ's life was spent in and out of hospitals and appointments. Once their health was stabilized and he had answers, early interventional therapies begun. I loved helping in any way I could, so I spent a lot of my childhood assisting with their therapies, attending appointments, and looking after them at home. Some of my fondest memories are around teaching them essential life skills to them, like walking, jumping, and talking. Aside from therapies and appointments, my caring role for CJ has involved emotional regulation, learning support, assistance with basic care tasks, and cooking. They are now 13 and doing amazingly in their first year of high school, and I couldn't be prouder of the person they have become. So, for the last 15 years, being a young carer has been a huge part of my life. I've absolutely loved it, but it hasn't been anywhere close to easy due to my own significant disabilities. We didn't always know I had disabilities. Due to poverty, family domestic violence, and the high amount of care and focus that was aimed at my mother and sibling, my own health needs were overlooked for many years. It wasn't until I was 14 that I underwent neurodevelopmental diagnostic assessments after years of struggling with mental health and education. I received a diagnosis of level 2 autism, specific learning disabilities, depression, anxiety, and Tourette syndrome. 2 years later, I have tested for the same chromosome condition that my sibling has due to having a lot of physical health abnormalities. This test was positive. Now, at age 20, I have a long list of health issues and disabilities. I use a wheelchair full-time and rely on my own formal NDIS carers for daily life activities. I've always been disabled. We just didn't recognize it until I was a little bit older. Looking back, growing up with these disabilities made being a carer a difficult task. I struggled with burnout and felt overwhelmed by the load of work that caring took. I felt behind in school, became isolated, and really struggled with my mental health. One of the hardest and most damaging parts was not having the time or resources to look after my health. I was too focused on making sure my family was being well cared for. The stress from this added to the declining nature of my health, and it's something I'm still trying to recover from. Unfortunately, a lot of carers don't have the right support in place to be able to look after themselves properly. Respite is so important for carer well-being. There is a lack of suitable funded respite options within Australia, especially for young carers and carers that have additional access needs due to disabilities. People who haven't been able to access respite care in any capacity are the most at risk for developing mental health and chronic health conditions from the intensive and stressful nature that care work is. When there aren't enough break options available, it's no wonder carers are exhausted and burnt out. Another difficulty that I have faced as a carer with a disability is having my caring role and my abilities be doubted by professionals and formal support people. This is most common in medical environments, but it also happens in education, work, and community settings. I have found that professionals have repeatedly ignored me while I am there to support and advocate for my family members, hugely because they don't recognize that a young disabled person is capable of providing care work. This has led to miscommunications, delayed medical care, incomplete access to education and work, and being left out of crucial conversations surrounding their care. I want all professionals to know that disabled people are capable of being carers, and it's not up to you to decide who is important to include. Informal supports look like all different types of people, and it is discriminatory practice to only want to include able-bodied family. When carers are fully involved, supporting disabled people becomes easier. Now that we have looked at some of the challenges that carers with a disability have faced, it's important to talk about how to best support disabled carers. We know that carers often don't have the time or resources to look after themselves, so it is imperative that professionals, especially those in medical, work, and education environments, are asking a couple simple questions to anyone who is a carer. Are you managing okay? And what can I do to support you? Those two questions can be the difference between a carer feeling seen, heard, and supported, and a carer falling through the gaps into burnout. From here, resources to services that can help carers should be given out. Carers New South Wales, the Young Carers Network, and the Carer Gateway are three incredible options, and they should be made known to anyone who provides care work. Our formal support people can provide a lot of help, but they're not the only ones. It's important that family and friends are also trying to support carers, and it's crucial that disabled carers are receiving this. Sometimes it feels like we're drowning with the load of work needed with being a carer, and we wish we had people come and offer help. I asked one of my friends who was a carer with a disability, and they said it would mean the world to them if people offered to drop by to make dinner or to help with chores around the house. This takes some of the pressure off this takes some of the pressure off the carer and gives them the opportunity to relax and take a small break. These physically demanding tasks can be the toughest on a disabled carer, so most would love for someone to assist. Other than physically helping, another way that family and friends can help is simply providing a listening ear and a space to be open. There is a huge feeling of relief when someone gives me a safe space to talk about what's on my mind. It allows me to reset, take a breath, and refocus. We need awareness on carers with a disability. There is massive intersectionality between being a carer and having a disability. There has been a lack of research and funded awareness for it. More awareness about people like myself creates understanding and systemic change. We need change so that carers with a disability are able to perform care work without significant struggle. We need recognition so that carers with a disability aren't being left out and forgotten. In 2022, from the Australian Bureau of Statistics, it showed that out of 1.2 million primary carers, 43.8% live with additional disabilities themselves. That is hundreds of thousands of people who need better support in this country. And this does not include secondary carers, which means this total number is going to be substantially higher. We can't sit back and ignore these figures. Action is required for the well-being of every carer in Australia. So I've spoken a lot about the negatives and challenges of being a carer. What about the positives? Being a carer with a disability gives me insight into their world. I know what it's like to not feel heard by doctors, to be segregated in education, and to be excluded in the community. I have years of lived experience of discrimination and ableism. This lived experience makes me a stronger advocate for the people I care for and for the wider disability community. I don't take no for an answer, and I fight until there is equal access and opportunity. Carers are often a disabled person's biggest advocate, and having that lived experience of disability allows me to see what really is needed for the people I love. I think this can be said for a lot of carers who have disabilities. To provide a perspective from another young carer with a disability about their positive thing, this is what my friend said. I would like to think that I've learned a lot from being a disabled carer. Things like knowledge of medical conditions, how to handle money, and even how to change a tire. It provided me with a lot of life skills. It's also given me a sense of community, and I've connected with a lot of people who I wouldn't have otherwise met. I think highlighting the positives is an integral part to advocacy in disability spaces, as it shows pride and love for one another, which is something we need more of in the world. Well, that's all from me for today. We have one more panelist up next who'll be speaking more on this topic. I'd like to finish off my speech with a massive thank you to Carers New South Wales for giving me this opportunity to share my story. And thank you for everyone to listening to me today. It's been a pleasure, and I look forward to hearing from the other presenter.
Thank you so much, Aspen, for your very, very insightful talk about your experience, your lived experience, and what needs to change on a system level already. This was very insightful, and I would like to now hand over to Kelli, who will share how Carers New South Wales is attempting to translate what we know into action to strengthen the work with carers living with a disability.
Thank you, Lucas, and thank you so much, Aspen. Incredibly powerful to hear your lived experience, and certainly is the reason for our work here at Carers New South Wales. So today, my name is Kelli-Ann Sives. I am the acting manager of the policy and development, and I'm going to talk with you about a project we have called Carers Living with Disability and Chronic Health Conditions. As has been already discussed, there is what we know about the cohort is that we know that carers provide unpaid care to people with a disability, chronic illness, mental illness and substance use and terminal conditions who is frail, but that many carers also are managing their own health challenges. And this can include living with a disability themselves, whether physical, sensory, intellectual, psychosocial, or living with chronic health conditions such as cancer, diabetes, or cardiovascular and neurological conditions. So this group is experiencing a dual role, providing care while also navigating their own health and well-being. The key challenge for this cohort is balancing those demands and while continuing in their caring role. And this is exactly why a targeted approach is needed to better recognise and support their unique experiences across the service systems. As has been mentioned, there is actually very limited data specifically on carers who are living with a disability or chronic health conditions, and much of what we do know comes from the Carers New South Wales National Carer Survey, which is conducted biannually. In 2024, we had over 10,000 carers across Australia that participated in this survey, and the findings show that this is a significant cohort. Nearly half, that was 46.5%, reported living with their own long-term health condition or disability, and almost half of those were managing multiple conditions. This cohort is on average older. They're at around 58 years, and the majority of the respondents in this cohort identified as female. We also see that around 1 in 2 are caring for their child, including their adult children. So while this is a large and complex group, they remain largely invisible in policy, services, and in data. And that gap is exactly what this project is aiming to address by building stronger evidence base and improving recognition across the system. But from the data we do have, in the National Carer Survey, we see that these carers report experiencing conditions such as chronic pain at 30.7%, chronic illness at 26.2%, mental health challenges at 20%, and arthritis, all of which can significantly impact day-to-day functioning. So many carers are not only providing care, but also managing their own complex and often multiple health conditions at the same time. And this creates a very particular set of pressures. Carers are balancing competing priorities between their own health needs and their needs of the person that they care for, which can be difficult to navigate. And as a result, this cohort is at much higher risk of fatigue, stress, and... Sorry, I just got a message that my slides weren't changed. Sorry, I'll start that again. Carers living with a disability or chronic health are experiencing lower well-being, higher psychological stress, and layered disadvantage, and consistently worse outcomes across key indicators. This includes lower well-being, greater social isolation, and increased financial stress. For example, carers in this cohort report significantly lower well-being than both other carers and general population. Nearly 2/3, 62.9%, report high to very high psychological distress, which is substantially higher than other carers. We also see that close to 70% experience social isolation, and while some remain in paid work, the majority are still facing financial strain, and with around 2/3 reporting that this year. So despite that, they are often under-recognised across service systems and services not designed to address both their caring role and their own health needs at the same time. This gap we're aiming to address through this project. So what does intersectional disadvantage look like? We see this compounding of disadvantage leads to real consequences. Carers faced greater difficulty accessing services, higher unmet needs, support needs, and reduced ability to sustain their caring roles over time. And ultimately, this contributes to poorer long-term outcomes. Carers managing their own health conditions are also fulfilling a caring role, which creates constant tension and competing priorities. They're also navigating multiple, often disconnected service systems, aged care, health and community services, which aren't designed to recognise both roles at once. Fatigue and accessibility barriers are significant, making it harder to engage with supports over time, and this makes sustaining their own wellbeing increasingly difficult. So this isn't just about recognising carers, it's about understanding the complexity of their situation and why a more tailored, coordinated response is needed. The carers living with a disability or chronic health conditions is part of our targeted carers projects, which sits within our PEAKS program as a targeted initiative between Department of Communities and Justice and Carers New South Wales. For this phase, we're focusing on carers living with a disability and chronic health conditions, but we have also worked on other diverse carer cohorts. Importantly, we recognise that many carers experience various challenges, including those who are ageing or who are young carers as well. So this approach considers these intersectional needs. At its core, the project is about improving how carers are recognised, supported and engaged with across the service system. It's a statewide initiative aimed at increasing visibility, improving access to information and strengthening supports available. The key objectives are to improve recognition and representation, to strengthen access and information and support to enhance wellbeing and build the capability of services to better identify and support these carers. So to deliver this, we are developing tailored resources for carers and practical tools for organisations to improve engagement, webinars to build awareness and capability across the sector. We're taking a consultation approach. So this means we're taking a co-designed approach. This includes having internal lived experience co-leads within the organisation, directly engaging with around 15 to 20 carers who are living with disability or chronic health conditions. We're also building flexible ways to participate, which include interviews, and we can use Auslan interpreters and visual aids to conduct these, and also online surveys to make sure engagement is accessible and inclusive. This reflects our broader commitment across the project to reduce barriers to participation. The consultation feeds directly into later phases, particularly in the development of tailored resources and in ensuring that everything is grounded in real-life experience. The focus areas for consultation align with our project objectives, including improving recognition and identity, access to information, service experiences, and understanding data and engagement practices, which will inform the types of resources that are needed. What success looks like in the short term, we're focused on improving access and awareness. That means that carers living with a disability and chronic health conditions are more visible and better able to find the relevant information and supports. In the medium term, we expect to see increased recognition of these carers across service systems, along with improved wellbeing outcomes as they access more appropriate and tailored support. And in the long term, success is about sustainability, where carers are recognised, supported and able to continue in their caring role without compromising their own health and wellbeing. Overall, the project is designed to move carers along a pathway from self-identification to having a stronger voice, to increase visibility and ultimately to better support their action across the service system. So where we're at, We are currently about to begin the consultations next month in June 2026. Carers, we would love to hear from you. You can scan the QR code on the screen, or also email Stressy Ramos at carersnewsouthwales.org to participate in those consultation interviews. We're also asking for professionals and organisations to help us reach carers in your network that may also have disability and chronic health conditions. And that is all from me. Apologies about the screen not sharing. The recognition, this project exists to make sure that no carer has to choose between being seen as a carer and being seen as a person in need.
Thank you so much, Kelly. That was very insightful into what Carers New South Wales is planning on. Thank you, Aspen, and thank you, Josephine, as well, for sharing your reflections. We are all together on the screen now. It was a fascinating ride through sort of what the academic literature says, which is actually surprisingly little, through lived experience and through how Carers New South Wales as a service provider tries to tackle that intersection. I found one very important point, and that may lead well to our sort of first question for the panel. There's sort of this tension. On the one hand, there's this missing recognition that carers generally feel, but particularly carers living with disabilities feel that they're not recognized as carers. But particular for, if I paraphrase Aspen, what you told us, on the one hand, there's the misrecognition of carers, and on the other hand, carers who live with a disability often don't have their capability to care recognized either. So this is sort of an interesting, that's an outsider talking. That is a very fundamental problem. And my first question to all of the panels is, how can we improve that recognition, the dual recognition of the capability of people living with a disability, of their capability to care, and of their roles as a carer in the health and other disability aged care systems. Who would like to start us off? Who has some bright ideas about the big systemic, the steps that systems could take to create this change? Yeah, Aspen. Is that was that a hands up?
I think we really need to shift the image that carers are able-bodied family members, down to like even like promotional things or awareness campaigns. It always shows a parent of a child who is disabled, and that parent, at least in the photos, doesn't look like they have disabilities themselves. I'd love to see like representation of people like myself who are physically disabled. So I'm in a wheelchair, and I've just like never, seen people like myself really represented visually as carers. That would be step one, just really shifting that image.
Thank you. That is a very important aspect in all communications. Yes. Anyone else? Josephine, I see you unmuted yourself.
So I'm going to say a very researcher thing to say, and that's we need a lot more evidence on it. We need a lot more research, and we need to understand better how needs differ depending on the disability, the person. Everyone's very unique. Everyone's needs are very unique, and that's part of the problem that at the moment carers are sort of looked at through one lens. And I think exploring their needs and shifting the focus onto carers a lot more, and understanding very specifically their needs and how their disability may affect their ability to care. So, for example, I guess in my field, if someone with an intellectual disability is a carer, then we would also try to understand their capacity in terms of their health literacy and their ability to understand health information, because if they don't understand health information very well, then it's likely that they're not able to I guess transfer that onto the person that they're supporting. So yeah, I guess my answer is there needs to be more targeted research to do with the topic, and then and more co-designed research.
Yeah, I would agree with both of you, and I would just add from I guess a service provider lens, what we really need to do is look at more whole of person rather than person centered. So I think, particularly when you're taking information as a service provider, looking at a really whole of person support needs, who supports them, what their supports, a sort of your whole care system approach that can then assess what needs and what support needs are around that person, as well as the person that is caring for them, which I don't think that service systems do particularly well, because they're always focused on the one client rather than looking at the full support network.
Yeah, that is a very important point, and I think that this point has been made before many times, but I think in this particular intersection, as you highlighted so well, this sort of moving away from the focus on one person to an entire network of people who also may be caring for each other, is really something that needs to occur, and that would be very urgent for policy, a very urgent policy to be implemented. But it would need to really shift sort of also the clinical perspective on who is being treated, who is how do you engage with health needs in a more holistic way, and that includes the health needs of other people around the person that you're looking at. And in that regard, sort of, that I think leads us well to sort of a next question, sort of, how could that actually look? What would actually a meaningful and accessible participation look like for carers with a disability in these decision-making processes, in service design, in care planning? Josephine, you mentioned co-design as one, and I guess co-production as one important aspect. What can that look like? How can that be best implemented? Are there any bright ideas from that we could really sort of bring forward as suggestions for practice change and for policy? Anyone wants to kick us off? Josephine, I believe sort of the research sector has sort of a pioneer role in the establishment of co-design and co-production in research and evaluation. How can other sectors in that regard learn from researchers? How can, for instance, service providers learn from researchers about and people with lived experience about co-design and co-production?
Sure. So I guess from a research sort of lens, we do a lot of work behind the scenes in creating I guess frameworks and models of care and ways of working together, and implementing them into a system. That's not entirely straightforward. I guess the way I can see things progressing is really through systems taking on ownership and I guess that's through policy, through the development of policy, and implementing that policy. And then, I guess in research, I guess in the health system, we call them champions. So someone who, really advocates for the rights of people with disability and the carers. And yeah, I think each system it really depends on the system as well. So I'm one of those people that get really bogged down in the details of things. But yeah, I think that there's no one clear answer to that. I think it depends on the system. In the health system, we really heavily rely on policy and getting things intertwined into that. And then we really heavily rely on champions within those systems to, I guess, create a ripple effect on other workers and education. I think that's key as well. Like really focusing in on educating. I always talk from a lens of health, just because I'm in health. I was just about to say health professionals, but yeah, just educating the teams, trying to access as much education as possible, and then the implementation of policy to protect carers.
There's a huge awareness raising piece in this work, obviously, but also I think we need to think about different, more flexible ways of being able to participate in the sort of care planning, in the support planning type space, instead of it being the traditional ways. It might be just having more flexible time frames, different ways of creating accessibility through different types of ways that information is presented and received, having different access to, as you were saying, education, and I guess that policy framework which kind of sets the stage for that in a way, and encourages providers to deliver those sorts of things in a much more flexible, having a much more flexible approach to the way that people can participate in their caring roles and in that sort of care planning for what's happening around them as well as the person that they're caring for, and a bit more fluidity in the service system, because at the moment it's very much individualised funding creates these sort of siloed service systems, and they don't work well together, and what could be supporting both the carer and the person that they care for together may not be able to be funded under one program. So yeah, there's lots of things that we can do to try and integrate those systems in a better way.
Yeah, Kelli-Ann, that is one thing that comes up a lot in research, is how the systems work and operate in silos, right? Which is not helpful for anyone. No one, the disability sector doesn't talk to the health sector, and no one knows whose job it is to do what. And the health system will say, no, that's disability sector's job. And then disability will say, no, that's health. So there's still bridging that gap and creating, like, I guess, continuity of care between all the systems is something that we don't do well yet. And that creates a lot of issues. So I think anything that helps with that, and it's normally, at the moment, we see it's down to the individual in the system to take the initiative to communicate with different service providers and things like that. It's rare that a system will have some kind of clear pathway on connecting with different services or systems. So that's probably a very good start. Creating a very clear pathway for these people and implementing it.
Aspen, did you have some reflections on that?
I think everything has been perfectly said already.
It is a recurring theme, sort of the siloing and the carer as the one sort of trying to chip away at the big barriers that sit between systems and trying to enable this community of care, continuity of care, is something that seems to be very much recurring across this event and across the work that we are doing. It was mentioned in every session so far in this event as one of the biggest obstacles. And it is, I think, quite indicative that, especially here, especially in the intersection of disability and care, it comes up again. How can we maybe move to really sort of practical steps? A lot has already been said. Aspen, I really liked your very specific need to sort of raise the awareness by sort of changing the image of both the carer and the person living with a disability. We've mentioned sort of the trying to implement co-design in policy. Who needs to act and who can take the next practical steps? Josephine, you said you rely on champions in the health system. Are these clinicians? Are these people living with a disability themselves? How can we champion that better? I'm sorry, it's a bit off script, but it is very much. I feel like you all have had already so much to say that I'm actually quite surprised that at the outset of the session we started from, oh, we know so little about what's happening there. And it seems to me like we actually do know a little. It's just that it hasn't been said by the right people or published in the right journals. Is that an assumption? Is that an impression? Am I right with that? What's do you have other impressions?
I think we know a lot from lived experience. I think that there's a lot of information floating around out there, and there's so many people living with the experience of having a disability and caring. But I guess the from a research perspective, it just hasn't been investigated, and unfortunately, if things aren't funded and given money to research, then there's not much, I guess, like proof that there's a problem happening. And without that solid proof, like reports and journal articles, it's very hard to get money to be able to implement solutions. So it's hard to say that there's a big problem and then advocate for that without having all of this evidence to back it up. And in, I guess, the world of policy and reform, evidence is research. So before that solid research and evidence comes where we can say, look, we can show you this is happening because we have all of this evidence. I guess in health and like quality healthcare, we do kind of rely on champions and people who have personal passions to implement change within their own services, even down to, health working in their own little silos too. Within a hospital system, they have their own little silos. So emergency operates separately to how wards do, to how, all the allied health teams do. So even that creates issues, and we haven't figured out how to fix that yet. So yeah, I think and this is just off the top of my head, I think that at the moment we do heavily rely on people who say, I want to make a change and I'm going to make a change before because there's nothing, helping that at the moment in terms of policy or framework. There is policies, but they're not targeted for this sort of population, right? They're very, very broad. So it's very easy not like, and a lot of health professionals have no idea about them, or, you know, disability sectors probably don't have much idea about the policy. They exist, but whether or not they're actually being implemented, who knows? So yeah, I probably just got a little bit off track there.
That's all good. This session sort of should have started, or hopefully did explore the topic a little bit. Any other comments on that? So the practical next steps.
I would agree with Josephine. We need the data. We need to have some investment in the area. I think it's such a the figures are quite staggering. Being half of all carers are reporting a disability or a chronic health condition, and yet there's such diversity within that group as well. So, you know, I think we need to know more, and we need to know how to target those supports to those particular diverse cohorts within that diverse cohort as it is, because there are young carers, there are older carers, there are people who are codependent in their caring relationship with the person that they're caring for, and there's just so much, I guess, complexity. We need to know more about it to be able to develop the systems and the services to support that group. And we just, as we know, carers are a hidden group anyway, but it's a hidden group within that hidden group. And the more we can raise awareness, the more we learn, the more we can lobby to get better supports in place.
Thanks. Aspen.
Yeah, I wanted to add, there is a phrase used within the disability community, which is nothing about us without us. And that really means that we need to be including disabled people, or in this case, disabled carers, in all areas of conversation, in all matters of like policy and changes, because we are the ones that know what we need. And by not including us, you're not going to actually be supporting disabled carers. So yeah, it's just a matter of actually including us, speaking to a wide variety of different people, and really understanding what is needed from people like ourselves.
Thank you. That is a great closing statement. We are at time. This was a very, very interesting and very, very engaging session, and I would like to thank all of you for your contributions to this session. I think you really highlighted very well what needs to happen next.